My name is Curt Deville, Associate Professor of Radiation Oncology and Clinical Director of Sibley Radiation Oncology. The Prostate Cancer Multidisciplinary Clinic offers a one-stop shop for patients regarding their prostate cancer diagnosis. We have specialists in medical oncology, radiation oncology, urologic oncology, as well as diagnostic experts in pathology and radiology. We also have research coordinators and research trial specialists, and even social workers to help navigate patients through the clinic and provide an overall review of their diagnosis. We provide secondary review of all of their workup that they may have had at outside institutions, and at the end of the clinic provide the patient with specific treatment recommendations regarding their diagnosis. The collaboration really improves the experience for everyone. You have all of the providers in the same room at the same time discussing a patient's case. And really the patient does not have to be sent from one office to another trying to put all of the pieces together regarding their diagnosis. With all of the providers in the same room, it's also an advantage to us to be able to discuss with our colleagues what specifically is going on in this case, what diagnostic tests we may need, and what ultimate treatment recommendations we'll all agree on at the same time. We have been working very hard to bring the latest and greatest in prostate cancer radiation technology and treatments to the Sibley community. We have diagnostic MRIs, the most advanced techniques in 3T multiparametric MRI, which can provide the most advanced diagnostics. We also have the UroNav targeted biopsy system, which was recently implemented at Sibley and allows us to do specific tumor targeting of tumors within the prostate. We've also implemented the spacer hydrogel, which is a rectal spacer that's injected between the prostate and the rectum prior to patients coming for radiation. That helps to protect the rectum from unwanted or higher doses of radiation and ultimately reducing the late side effects of treatment like rectal bleeding. We've also implemented what's sometimes called, known to patients as a liquid radiation, which is radium-223. And that is a systemic radiation treatment for patients with metastatic, castrate-resistant prostate cancer that has spread to the bones. We have several ongoing clinical trials for patients with prostate cancer that will undergo radiation treatment. I'm the lead investigator of a specific trial which is incorporating the use of a prostate-specific PET scan called a PSMA PET scan that's been developed by the Johns Hopkins nuclear medicine team. And we're taking patients with high-risk locally advanced prostate cancer and seeing if we can detect areas of spread beyond the prostate better than our conventional scans like a CT or a bone scan. We're also assessing if we can see early predictors of treatment response based on their imaging response prior to hormonal therapy and after hormonal therapy. The referring physician will always be kept up to date, certainly when they bring their patient or refer their patient in for treatment. And after the treatment, we generate a treatment summary with specific recommendations on how they should be managed. We continue to follow patients over the long term. However, we maintain great relationships with our referring providers to ensure that they're aware of all that's going on with their patient.